Hello, I am Dr. Waples, the Medical Director and founder of Restore Medical Spa, and today we're going to be talking a little bit about injectable body sculpting. So, for starters, what is injectable body sculpting? I think it's fantastic. It's a wonderful new medicine that basically, when you inject it into a fat deposit, permanently destroys the fat cells and allows us to sculpt and change body contours however we want, which is a very, very fun and interesting medication to use. I personally love it, and I personally have used it a great deal, as you can probably tell. But what we're talking about today is, when do you choose body sculpting versus when do you choose liposuction? Because every tool has certain ways that it shines and certain things that it's harder for it to do. So generally speaking, injectable body sculpting is a fantastic tool when you've got a small and isolated area of fat. Something about the size of a fist or two fists together, something about that size that does not have a lot of fat surrounding it, something that's small and isolated. In that situation, you can use injectable body sculpting. It does a fantastic job, very little downtime, almost no pain, no surgery, none of the risks of surgery. It's a wonderful, wonderful tool for that. When you start talking about larger areas of fat, something that's maybe circumferential all the way around the body, or something that's larger than about this, then the amount of the medicine that you need to use to dissolve all that fat starts to get a little bit larger than we are allowed to inject by the FDA. And then that's when liposuction, because they can take out as much fat as they want, liposuction starts to become a more reasonable tool. Now, liposuction has some downsides. Has all the risks that go along with surgery, anesthesia, all of those things, going to have a bigger downtime, more bruising, more pain, but it's able to tackle those slightly larger areas. So small, isolated area of fat, injectable body sculpting, fantastic tool. Larger areas, liposuction might be the way to go.